I'm Dr. Gabi with Amazing Life Chiropractic and Wellness. Oftentimes when I talk to people, they think that chiropractic care is only for adults, for neck pain, back pain, or whatever other pains they might have. Well, kids have pains too. They might not just tell it to you. What happens is, a lot of times if kids are crying and you know they've been fed, you know they slept well, you know that their diapers have been changed and they're warm and they're clothed, then there's no reason for them to cry hysterically in any way. So there might be an underlying cause. Oftentimes I see kids at the clinic that need treatments for colic. That's because they have a lot of gas and they can't sleep at night as well. They're crying all the time. So chiropractic care in the low back can actually help with colics in young infants. We get ear infections that we can look for. Ear infections oftentimes are not bacterial or viral. 80% of the time, it's actually just accumulation of fluid behind the eardrum. So that'll just put pressure in the ear, and of course it's going to be painful. But we can treat that by just adjusting the first vertebrae and massaging the ear canal on the outside here. Other things that may be happening is that your child, you find, is using their right arm more, or their left arm more, or their left leg more than the right one. That is a sign that there's an issue in the joints. Kids should not have any dominant hands or feet before the age of 4. So if you find that your child, whether they're in the crawling age or they're already walking, but they're always doing the same thing with the same side, you might want to get that checked out, because they should be able to use both limbs up or down equally. At our clinic, I also see a lot of kids, especially infants, who have this reverse schedule. So they will be sleeping a lot throughout the day and crying throughout the night, and they're all reversed, and that makes parents not having sleepless nights. So a lot of times it's just a quick adjustment, and we can change the circadian rhythm, and that way they'll actually sleep at night and actually be active during the day like we really want them to be. Chiropractic adjustments, of course, for kids are different than for adults. We usually use very light pressure with our pinkies or small adjustments. There's no audible release, there's no cracking the bones like a lot of people think chiropractic is. And kids often will get 1-2 treatments at the most, and they thrive. They don't need a lot of adjustments because they're not as bad as broken adults that take a long time to treat. So if you have any concerns or any questions about what might be happening with your child, just give us a call here at Amazing Life Chiropractic and Wellness.